I did mine on hypertension, which is of course blood pressure. Okay, you go to the next slide. What is blood pressure? Blood pressure is the force of blood pushing against blood vessel walls. High blood pressure, which is abbreviated for HBP, means the pressure in your arteries is higher than it should be. It is also referred to as hypertension. Blood pressure is written as two numbers, such as 112 over 78. The top number, which is the systolic number, is the pressure when the heart beats. The bottom number, which is the diastolic number, is the pressure when the heart rests between beats. Normal blood pressure is below 120 over 80. Some people are at risk of developing high blood pressure because of gender. A higher percentage of men than women have high blood pressure until 45 years of age. From ages 45 to 54 and 55 to 64, the percentages of men and women with high blood pressure are similar. After that, a much higher percentage of women have high blood pressure than men. Hereditary, including race, just like height, hair, and eye color, runs in families, and so can high blood pressure. As a person ages, they develop higher risk for high blood pressure. Their blood vessels lose flexibility with age, which can contribute to increasing pressure throughout the system. Physical activity is good for your heart and circulatory system. An inactive lifestyle increases the chances of high blood pressure and also makes it easier to become overweight or obese, which are also some of the things that increase your chance of developing high blood pressure. Heavy and regular use of alcohol can increase your blood pressure dramatically, as well as being in a stressful situation. Smoking temporarily raises blood pressure and increases your risk of damaged arteries. African Americans are more likely to get high blood pressure. In these groups, high blood pressure often occurs early in life and is more severe. Untreated high blood pressure can damage and weaken your arteries. You can go to the next one. Okay. High blood pressure often does its damage without creating symptoms. But when blood pressure numbers rise above 180 for the systolic pressure or 110 for the diastolic pressure, you will need emergency treatment. Uncontrolled high blood pressure can injure or kill you. It is sometimes called the silent killer because high blood pressure has no symptoms, so you may not be aware that it is damaging your arteries, heart, and other organs. Possible health consequences that can happen over time when high blood pressure is left untreated include damage to your heart and coronary arteries, including heart attack, heart disease, congestive heart failure, aortic dissection, isopsychosis, stroke, which is the fatty buildup in the arteries that can cause them to harden, kidney damage, vision loss, erectile dysfunction, memory loss, fluid in the lungs, angina, and peripheral artery disease, although these are not symptoms of high blood pressure. High blood pressure is a symptomless disease except in its most extreme case known as hypertensive crisis. 77% of Americans treated for their first stroke have blood pressure of 140 over 90. 69% of Americans who have their first heart attack have blood pressure of 140 over 90. And 74% of Americans with congestive heart failure have blood pressure of 140 over 90. Take your medicine the way the doctor tells you. Know what your blood pressure should be and work to it at that level. Okay. 8 ways you can control your blood pressure, including to the American Heart Association, are: eat a better diet to include reducing salt, enjoy regular physical activity, maintain a healthy weight, manage stress, avoid tobacco smoke, comply with medication prescriptions. If you drink, limit alcohol and understand hot tub safety. Okay. No one knows exactly what causes most cases of high blood pressure. Through risk reduction and treatment of high blood pressure, you can lower your risk for many of these diseases. Knowing your numbers can lessen your life. While there is no cure, high blood pressure is manageable. And I got a quiz. Okay, the first one was, which of the following is the most desirable blood pressure reading? Okay, yeah, it's B. 120 over 180. 140 over 80 is good, but the top number is a little too high. But the B, that's too high. If yours is over 180 and just 120, you need to go to the doctor. And 130, that's high too. Over 90, 130 over 90 is high. Okay, number two. The main cause of high blood pressure is it's unknown, but a lot of those do go with having high blood pressure, but they really don't know the cause of it. Okay. Which of the following groups has the highest rate of high blood pressure? Yes. Okay, you go to victory. Okay. Which of the following is more likely to contribute to high blood pressure? B. It's B. Yeah. Okay, and number five, if you or a close blood relative has high blood pressure, you have a high risk of stroke. Do you know which of these is a stroke warning sign? Can y'all see him? A says sudden numb. Oh. Yeah, it's out of the above. Yeah, on the multiple choice test, that's the best way to go. But that's it. My mom let me.
Any questions for Cierra?
Anybody in your family have high blood pressure?
My mom.
Have you ever been tested?
No, I have not. I hope I don't get it. But I took a CNA class, so I've checked my blood pressure a lot. But I'm fine right now. Is it? I need one more. I need one more. Yeah, so I know she's on her side. I don't think no one on my dad's side has high blood pressure. I'm not sure. Yeah. I honestly can't tell you because she has known she's at high blood pressure for a while. We were little, so I mean I'm not that old, but we were young, so when she got tested, she knew when she just started taking her medication then. That's it.